you want to promote your business? Do you want to talk about your nonprofit organization? Do you want to talk about your culture? Introducing the online web TV, Afrique Today. Fogham, where you can watch us live at the same time on 4 platforms: Facebook, YouTube, Twitter, and using the Afrique Today app. Download our app today for Android or Apple. Promote your business today. For more information, go to www.afriquetoday.com. Afrique Today, the best of digital TV.
Good afternoon and welcome to our second session as we talk about health issues in our community. My name is Josephine Garnham and this is a program that is brought to you by the Immigrant Community Services and the Michael and Maurizia Pacha Foundation. Today our topic will be about HIV and AIDS, and we have 2 subject matter experts today that we are so happy to welcome, Dr. Sikipa and Tanya. We're also grateful to Afrique Today Online for hosting this show on their platform. I will start by introducing Tanya. And first of all, let me tell our audience, we apologize for the delay. As you know, in this technical world we live in, we had some technical issues. So our apologies for the delay in starting the show. We hope you will find this very informative, and we would also have questions and answer sessions. So if you do have your questions for us, please post it on our Facebook page or on Afrique Today online. There's a section there where you can post your questions and we'll get to them. So first, I would like to introduce Tanya. Tanya, welcome so much. Tanya Munemo, a public health professional with more than 20 years as a registered nurse, and she has worked in 3 continents. Her education includes qualification as a registered nurse, bachelor's in midwifery, and master's in public health. Tanya currently works as an RN care coordinator and a program coordinator for the Hiv program. Tanya enjoys helping people achieve their best health status by providing health education and links them with resources and care that they need. When she's not working, she enjoys spending time with her family and friends. Welcome, Tanya.
Thank you, Josephine. Happy to be here.
Thank you. And we're also very, very honored to have Dr. Godfrey Sikipa. Dr. Godfrey is actually overseas, and so we're very grateful that you're here. I know it's pretty late for you to be on this call, so we're grateful. And Dr. Godfrey is a physician with a graduate qualification in maternal and child health. He's the founder and currently Chief Executive Officer and Senior Technical Advisor of Compre Health Services, a private health consulting and service delivery company. He's also current member of the Technical Evaluation Reference Group, TERG, of the governing board of the Geneva-based Global Fund to Fight AIDS, TB, and malaria. He has worked at various levels at the Zimbabwean health system for junior hospital clinicians and permanent secretary for the Ministry of Health. So Dr. Sikipa, you have quite an extensive background. So I would only say just a little. Dr. Sikipa has a Master's of Science in Maternal and Child Health, Institute of Child Health, London University, a Bachelor's of Medicine, and a whole cadre of qualifications. So welcome to you both, and we will take it off immediately. So to give our audience just some context, so HIV has taken an enormous toll since the first cases were reported in the United States. And there's an estimated of over 38,000 people that were diagnosed with HIV in the United States alone in 2018, and an estimated 1.2 million in the United States that are presently living with HIV. Of those people, 1 in 7 do not know that they're infected. We're here having a very important conversation, one that is full of stigma, one that is not talked about as often as we should. But before we go into the depth of this conversation, we will start by Dr. Sikipa. What does HIV stand for? I know we're having this conversation, and let us start with the basics. Tell us, what does HIV stand for?
Okay, thank you very much, Josephine, for that question. It's important because a lot of people sometimes find it difficult to define these words, the immune part of it. So HIV, the H stands for human, and the I is for immunodeficiency, and the V stands for virus. So I emphasize the immuno because later on we'll be talking about immune. So HIV stands for human immunodeficiency virus.
Thank you so much. And so we sometimes will talk about HIV, AIDS, HIV and AIDS. Can you tell us what AIDS mean and the difference between HIV and AIDS?
Okay, so AIDS stands for acquired immune deficiency syndrome. Remember, when I was talking about the virus, I said the immunodeficiency virus. Now talking about AIDS, we change it to immune deficiency syndrome. So basically, the difference is that the virus, HIV, is the germ or the bacteria that causes the disease called AIDS. So basically what happens is that the virus attacks the immune system of the human body, and it exposes the body to infections, resulting in the disease called acquired immune deficiency syndrome, AIDS. So the HIV is the causative organism, and the AIDS is the disease.
Thank you so much, Dr. Sikipa. So we've spoken about how the numbers is quite scary, but I'd like you to reiterate how big the HIV epidemic is in the whole world and how big it is here in the United States.
Yes, Tanya. Globally, that is throughout the world, it is estimated that over 37 million people across the world are living with or are infected with HIV, the virus. I'm not saying that all those people have AIDS, but they are living with the virus. In focusing on the United States, it is estimated that is in 2018, it was estimated that about 1.2 million people in the US are living or were living with HIV. So as you can see, the numbers are massive. And in the US, we have our fair share of people that are living with HIV.
Thank you so much, Dr. Sikipa. And Tanya, as you know, there is a lot of misinformation about HIV, its transmission. There's a lot of stigma around it. Can you let our audience know how is HIV transmitted from one person to another?
So HIV is transmitted by certain bodily fluids that would be coming from an infected person to somebody who's not infected. And prior to all the research and education, people did not know exactly how HIV was transmitted, which led to fear. When people heard that somebody had HIV or AIDS, and there wasn't even a differentiation at that point, people would just worry that just by communicating with somebody who's HIV positive, they would get it too. So all those myths have to be debunked and educate the public about the real truth about how HIV is transmitted. So basically, sexual contact by somebody who's HIV positive. And also, I'm sure Dr. Skipper will go into detail about this. Because of the advances in treatment and research, it is possible that somebody can be infected with HIV and not have AIDS and not have enough of a viral load to transmit the disease or the virus to their partner. That's one. And another way it can be transmitted is if somebody comes into contact with blood or bodily fluids that are infected, say somebody gets injured and you have a cut and your open cut comes into contact with infected blood or bodily fluids, and it's not all bodily fluids. Saliva does not transmit HIV. So it is certain bodily fluids like blood, semen, and things like that. So if you get injured and you come into contact with somebody's blood that is infected, it's a possibility that you can get infected. And also that goes to when you work in the healthcare field, there are instances where you can be taking care of somebody who is HIV positive, or you don't know their status, and you have a needle prick. And that is another way that if that person is HIV positive and their blood gets into your system, you can get infected. And then lastly, I would like to say when unborn children of infected carriers, infected persons, if measures are not taken to ensure that that child is delivered in a certain way that makes sure that they are not infected, the child can be born HIV positive. And also there are treatments that a pregnant woman can start, being on to prevent the likelihood of them transmitting HIV to their unborn child.
Oh, wow. Thank you, Tanya. That's quite a lot of information for us to take in. Excellent. So we talk about viral load. You're talking about viral load. You're talking about how the different how you can get the infection through different means, how infection happens, and blood. And there's always this stigma and misconceptions about only this particular group of people could get HIV, only this particular type of person could get. And what I'm hearing you say is that anyone can get HIV, and it could happen in the most, by helping somebody through, needle, just by, if you don't know the person's status and you get pricked by a needle that person had been used on that person, a simple mistake like that could infect another person. If you have one partner, but that partner, had HIV before and did not disclose, you could be in a very serious relationship and still end up. So you're really giving us a lot of information, and I think it helps, break down those barriers that we keep seeing and those misconceptions about how you get HIV, how it can get transmitted. I'm gonna back up a little bit to Dr. Sikipa. Given what Tanya has said, is HIV and AIDS treatable? And then can one live with the virus in the body without being sick?
That's a very important question, Josephine. The good news is that, yes, indeed, HIV or AIDS is treatable and a manageable condition, almost just like high blood pressure or diabetes. So that's the good news. But unfortunately, the bad news that at this stage of our development, it is not curable. You can bring down the amount of virus in the body to a level that is not detectable, but it remains in your body. We don't have the treatment yet to completely eradicate from the body. So the good news, as I said, is that you can treat it and keep the virus low, and you can have a happy life living with the virus.
Thank you so much, Dr. Sikipa. So right now we do not have, there's no vaccine for HIV, but what you're saying is we can reduce the viral load. Now, when you say reduce the viral load, for the person out there, what is the viral load and how can one reduce their viral load? And how important is it for them to reduce their viral load?
Okay. Viral load simply refers to the amount of virus in one's body or the numbers of virus. And you're talking about millions and trillions of these things. So when we say reduced viral load, it means that we have reduced those numbers to very low levels and they are not able to cause disease in your body. So that's basically what the drugs do. They manage to keep the viral load or the number of viruses low to an extent that your immune system or the soldiers that help you fight disease can overcome the effect of the virus.
Thank you. So you're saying taking the medication, if you take that medication properly for HIV, you could actually reduce the number of virus of which is what you're referring to as a viral load in the body enough to even make it undetectable, which means people can have a healthy and prolonged life by sticking to the treatment.
Yes, and this is why it's vitally important for people to stick to the treatment regimen or the treatment program that their healthcare workers put them on. It is very important to also live healthy, eat properly, and exercise, sleep, and make sure that you're taking care of your body when you are on these drugs or when you have the virus in your body. By doing that, yes, indeed, you can have a very healthy, normal, productive life.
That is very comforting to know, and that is a positive news in terms of what you're saying. HIV is not a death sentence when one follows the protocols that is out there for them. And so, Tanya, again, so backtracking, Tanya, how does one know that they may be infected, and how does one prevent HIV infection? So,
okay, thank you, Josephine. So there is no way of knowing without being tested. So that is why the approach now is to offer testing to everybody, because like we said, it can happen to anybody. And the approach is called status neutral, where we treat everybody regardless of the perceived risk. We treat everybody as if they're at risk for catching HIV. So that helps in minimizing the stigma that's associated with seeking care for HIV-related issues. So I would say the only way to know for sure is seek out testing, and the program that I coordinate, HIV engagement program, is one of the community organization programs that offer testing in the community. You don't have to have insurance. You don't have to go to the doctor's office for this particular type of testing. And there are many community organizations doing outreach in the community. And with our organization, we target minorities, specifically immigrant populations, that we know for sure the subject of HIV and testing and treatment is still very much stigmatized. So people shy away from seeking care. So we are going out into the community to bring the care to the people, to encourage people to come forward to get tested, and to encourage people to spread the word, talk about it freely. It's not something that has to be discussed in dark alleys anymore. We speak about it freely. If we want to be a healthy nation, if we want to be a healthy community, we need to know our status as a community. So we need to know who is HIV positive so that they can get treatment, and those that are not, so that they can get the education, they can get the support they need to remain healthy. And also for those that will have been diagnosed, support is out there through organizations like ours, the Hiv engagement program. Support is out there from the get-go. Once you are diagnosed, we hold your hand, we explain what it means to have this diagnosis, we connect you with the providers that will provide treatment. If you don't have insurance, we connect you with that. We make sure you get started on medication. I'll try not to go on a tangent here, but it's something that I'm very passionate about. But basically, the only way to know if you're HIV positive or negative is to get tested. You can't say because my husband and myself, we are responsible people. You don't know that 100%. You don't know what you've been exposed to. So I do encourage people to get tested.
Thank you so much, Tanya. Never apologize for being passionate about a great cause. You're saving lives and making a difference in the lives of so many people, and that's really wonderful. So, Dr. Sikipa, I think Tanya has given us quite a lot of great information and the work that the Hive engagement is doing. I'd like to, again, back up a little bit, Dr. Sikipa, and tell us when somebody tests positive, what should they do?
Okay. Number one is, as Tanya said, they need to be tested, right? And once they turn out to be positive, the most critical thing is to get started on treatment. And the beauty about being started on treatment, there are several advantages. Number one, you will be able to keep your own viral load low, which means you never really get sick. And nobody will ever even get to know that you are HIV positive because you'll be looking like anyone else. And number two, and that's the other beauty, is that the chance of passing the virus to your partner, to your sexual partner, is minimal, if not completely eliminated. So the importance then is, once you're found to be HIV positive, go to your healthcare provider, get started on treatment as quickly as possible, and stick to the treatment program and rules. So.
Thank you, Dr. Sikipa. So what I hear you say is that timing is key. When one tests for HIV and is positive, the timing to seek the right care and to stick to those care is important in ensuring that one can actually live a healthy life, a prolonged life, and can even limit the chances of transmission when on the right treatment. That is really incredible news. And I think that takes away, just that knowledge should take away the stigma and the fear surrounding HIV. It is so important for people to know that. As we talk about stigma, and this is for both of you, and maybe Tanya, you can start. One of the biggest challenges with HIV is the emotional and mental strain that comes into play when one is diagnosed. The lack of support from the community, the fear of what the virus holds, the fear of of life. Is this it? Am I done? How can people cope? So in terms of the individual, but also society and the community around them, how can they help support folks who have been diagnosed with HIV to make sure that their mental health is really taken into consideration and the support that is required is given, and we can destigmatize HIV? Tanya, why don't you go first?
All right, thank you, Josephine. So what I think is important at the point of diagnosis is, first and foremost, don't panic. Like Dr. Skipper said, it's not a death sentence. I don't want to minimize it. It's still a monumental thing to be diagnosed with HIV, but know that there is help. You don't have to go it alone. Here in Montgomery County and Prince George's County, we are here to support you And there are many clinics, community organizations that are on standby to help you. So you might find, because I mean, the diagnosis can be made in different settings. You could have just gone to the hospital for something different, and you end up with a diagnosis of HIV. And as we know, sometimes hospitals are busy. They might not have time to sit down with you and talk to you about what this means. And you go home, you're worried. So first and foremost, seek out a healthcare provider that is an expert in the field of HIV, because they have been dealing with this. In our area, there are infectious diseases specialists, infectious diseases clinics that work with social workers, that work with case managers, that are available to support you. I think it's important to go with specialists because they also know the latest treatments, because even treatments have come a long way. The regimens are not as cumbersome anymore. You don't have to take, 10 pills. There are different options now. So for your mental health, get support. Don't feel like you have to do it alone. If you have a trusted friend or family member, you can start there. But understanding the stigma surrounding this, you might not even want people surrounding you to know about this. So I would say seek help from a licensed mental health practitioner. Talk to somebody, a therapist, a counselor, so that if you want your conversation to remain confidential, have a session with them. Talk to them about your worries. Talk to them about what you're afraid of. This impacts your life in many different ways. They may help you to unpack all that. And then there are support groups that are available in the community. As a matter of fact, the HIV engagement program, we do have support groups that are tailored to different people's needs. You might be somebody who is starting a new family and you found out that you have this diagnosis when you were going for your antenatal care. We have a support group specifically for that demographic. You might be in the elderly bracket, We always talk about people didn't used to live this long with HIV, but now they do because of the medications and treatments that are available. We will have support for you in the form of support groups. And we are also trying to educate community leaders, especially our spiritual leaders in the community, about HIV and its impact on mental health. First and foremost, for them to understand privacy, issues related to privacy and confidentiality, so that their parishioners can approach them without the fear of their private information leaking back out into the congregation. So we engage pastors, imams, community leaders, and we have conversations with them. We let them know of the resources, because once you speak with them, if you need a referral, we make sure they have resources, they know where to send you, and they are also equipped with the ability to support you. And some of them are even counselors themselves. So certainly you don't have to do this on your own. It's a huge burden to try and, deal with something like this, trying to hide it from your family and then have it, heavy upon your heart all the time without anybody to talk to. So those are the different avenues I would recommend. Thank you.
Josephine, if you don't mind, I would like to jump in on the issue of stigma.
Please go ahead.
I think that one of the sad things that happened about this epidemic at the beginning was that being infected with HIV was associated with loose morals, with loose sexuality. And that's one of the worst disservice that ever happened in this epidemic. My personal story is that the first person I came into contact with who had HIV was a most religious woman. I always called her Mary, Mother of Jesus. She was a devout Christian, and in every way. But she was married to somebody who perhaps had not been like her, and she got infected. So you can imagine that this girl would have been feeling guilty, and people looking at her as if she has done anything. Yet she was a pious woman. Believe you me, earlier on today, I had to deal with a little girl who is now aged 22. She was born with HIV. This little girl, even today, doesn't have a boyfriend. I don't think she has had sex, but she was distraught today because somebody had invaded her privacy and found that she had HIV pills. And she was crying. She was all over the place. But poor little girl, she hasn't done anything wrong. So the whole thing about stigma, I think, is so sad. And the only good news is that I think slowly the world and people are beginning to accept that people don't have to be immoral. And there are a lot of kids now who are becoming young adults, who are becoming teenagers, who have not been immoral, but they were born with the virus through no fault of their own, and perhaps even through no fault of their mothers. So
that is so important, and that is such a powerful example. Thank you so much for sharing that with us. So Tanya, please tell us a little bit more about what the Hive engagement does. How can people reach out to you? I know you've mentioned, and this is really important to reiterate, the processes that have been put in place to make sure that there is strong confidentiality, to make sure HIPAA standards are adhered to, and to give the utmost support that people need. So can you please tell us a little bit more about the Hive engagement program and what it does, and how can people contact you and what exactly you do?
Okay, thank you. So the Hive engagement, the HIV engagement program is a community outreach program sponsored by a federal grant, the Ryan White grant, to reach out to minorities in Prince George's County and Montgomery County, to identify people that are living with HIV. They may have been engaged with care at some point and then fallen out of care. So we are trying to identify them and reconnect them with treatment, reconnect them with care and resources that they need. The second part of it is, in an effort to identify people living with HIV, we do testing. We do outreach and testing in different places in the counties, where we partner with other community organizations. And I just want to touch a little bit on the stigma issue in saying that we have found that sometimes when we just set up and we say we are offering HIV testing, people don't always come freely for that because they're worried about who's going to see me coming, and what are people going to say. Unfortunately, that's the world we live in. So we collaborate with other community organizations like the African American Health Program, which provides other screenings for things like blood pressure, blood sugar, weight, and we we work together and include HIV testing in that to provide a holistic approach. Because you'll find most of the time when somebody is HIV positive and they don't know it, they might have other conditions that they're trying to deal with and be sick. So we want to treat the person as a whole. If they have hypertension or high blood pressure, we want that to be, treated as well. And we don't want HIV to stand out as, this one issue that we target on its own, because it's equally important that we deal with all the other issues that plague our community. And once we find out, once we do the testing, if you are found to be positive, we help you. Like I had said, we hold your hand. We talk to you about what it means now, what needs to change, because the truth is things have to change. You cannot carry on like before. You need to start treatment. You need to eat healthy. So if you do not have a secure source of food, we connect you with that. If you don't have mode of transportation to your doctor, if that's the reason probably why you fell out of care, we help you get transportation. If you don't have somewhere to live, we connect you with housing. So basically, we help you get diagnosed, and then we help you get not just the medical treatment, not just the medication, but also the other social services that will ensure your success, because we do not expect you to remain compliant with treatment if you are living on the street or if you don't have enough food. So we have navigators that we work with, and these navigators are trained in confidentiality to make sure, because this is very sensitive, it's health information. So everybody goes through training to make sure we abide by the HIPAA privacy rule, which governs all the people's medical information. And we use gadgets that are encrypted, we use emails that are encrypted, and we only have our staff use company or foundation or issued computers and tablets, so that way we keep information secure. The system that we document in is through the State Department of Health, and that is very secure in itself. But I know sometimes when people hear the state, the county, they worry about, what if I do not have a legal status? That is not an exclusion. We serve everybody. We provide, there is a medication assistance program through the Department of Health. If you are positive and you need medication and you don't have insurance, they will provide it for you free of charge. You don't have to pay if you don't have other insurance. If you have other insurance, they just pay as a secondary insurance. And if you absolutely don't have insurance, we help you apply for an insurance that you are eligible for, because you have the diagnosis of HIV, because they want everybody that's HIV positive to be in treatment. That's the only way they can eradicate this. And we, like I mentioned, also we have support groups. We take care of the physical, the social, and the emotional as well. We have support groups, and we work with mental health providers that we link people to. If somebody is struggling emotionally and we've tried to support them on our own and they need further help, we send you on to work with somebody who understands your culture. That's the other thing we pride ourselves in, being in this community. We provide culturally sensitive care, and we try to understand the different barriers that make people not stay in care, because cultures are different. You know, the healthcare system is complex, and we help you to navigate it. And the information for our program is on the screen. Please feel free to reach out to us. We have presence on social media. We are on Facebook. We are on Twitter. We have our own website, hivecare.org. All these are ways we try to reach out to the community so that we can spread the word and get people the help they need. Thank you.
And Josephine, if I can also add to what Tanya was saying about treating HIV, just like all the other diseases like hypertension or high blood pressure and diabetes. This is why now we actively encourage people between the ages of 13 and 64 to get tested annually, just as much as you would be tested for cholesterol or any some other chemical in your body. So it is important that when you go for your annual medical, you should almost demand an HIV test. It's part of cholesterol or diabetes.
That is so important, Dr. Sikipa, because it's also a way of normalizing the process. You know, when we go into the doctor, there are certain things, you know, you do your pap smear, you do your breast check, you do all of these preventive and just daily, you know, regular routine checkups that are, you know, that tell whether you're at risk or whether or not, and then early detection is key. So again, this is kind of what you're saying is reiterating, is this is kind of an advocacy to normalize HIV, where it can be a routine part of your general health and wellness checkup, which is so important, because then it takes away the stigma of, oh, I don't want to go do. You can do it in your doctor's office for your annual checkup. You know, it takes away a lot of the barriers that people face in terms of going into specific locations where everybody knows, you know, what those locations are for.
Yeah, indeed.
That is so important. Thank you for raising that. So we have just a few minutes left. Dr. Sikipa, is there anything that we have missed out that you would like to let our audience know, like to tell our audience? And again, actually, there's one thing I want to ask. Tanya, you talked about this cadre of information and resources that are available. Dr. Sikipa, are these resources free? Is ARV, is the antiretroviral medicine, are these free? Is the post-exposure prophylaxis free? Because when people hear all these things that come with it and what needs to be done, everybody is worried. Tanya, thank you for mentioning about the insurance and the opportunity and options for seeking insurance and getting insurance when necessary. But for the medication, for all of these treatments, is there a cost or are they free? Dr. Sikipa, you can answer that question.
Yes. At individual level, you can either be covered by your usual normal health insurance. Earlier on, Tanya mentioned the Ryan White program. That is a program that was started in the US years back, which seeks to ensure that everybody who requires services for HIV and AIDS has that service provided to them, including drugs and all these tests that are needed. So there shouldn't be any question of not accessing these services, be it the drugs or tests.
That is so important. And it is, I think, about 50% of the people that are diagnosed with HIV in the United States actually receive services through the Ryan White HIV/AIDS program each year, which is incredible, which makes a huge difference in people's lives by giving access to these resources that are needed.
Yeah. And one would just like to say that no one today should have to die of HIV. These things can be prevented. Something can be done if only you come forward quickly, early diagnosis, stick to your treatment program.
Thank you so much. Tanya, any final message for our audience?
Yeah, I just would like to speak briefly to maybe people that are already living with HIV and they are wondering if they need to do anything differently, anything extra, or if there's something else out there for them. I would just say to take care of yourself, really. Take your medications as prescribed. Don't ever stop your medications without consulting your doctor. Like Dr. Skipper said, that's your first lifeline, and you want to stick to that. Don't miss any of your appointments with your doctors. Regular follow-up is very important so that they can keep track on your labs, what's going on with you, if they need to adjust your medication regimen. That's part of taking good care of yourself and being a part of your treatment team. Eat healthy, exercise, and if you were engaging in any unhealthy behaviors, it's time to rethink that. And, if you were smoking, you want to stop smoking because you know what that does to your body. If you drink excessively, you need to stop drinking excessively. That might interact with your medications and make them less, effective. You want to educate people. You don't have to make it personal, but you can just continue what you want to see change. Educate people around you about what you know about the condition itself, so that the community can become more informed. Thank you.
Thank you so much, Dr. Sikipa, and thank you so much, Tanya. We have learned a lot today. We have learned that there is 1.2 million people that are living with HIV in the US. Nearly 1 out of 5 people don't know that they're infected. We've learned that getting a HIV test can lead to getting the medical care needed to stay healthy much longer, and that HIV is not a death sentence. We've learned that people who don't know they have HIV have a higher risk of serious medical problems and early death because there's the comorbidity part where you have multiple issues that are happening. And so it's so important to go in for care and to start your treatment as soon as possible. We've learned that people are at a greater risk for infection, even if they have more than, if they have more than one sex partner, if they inject drugs, men who are having sex with other men, and we should make it a routine to get tested once a year or a lot more often when you're at a high risk. We've learned that lowering the amount of virus in the body can keep a person healthy with HIV/AIDS longer, with HIV much longer. Keeping the virus under control with medicines greatly lowers the chances of passing HIV to others. We have learned about the HIV engagement program that is offered by the Immigrant Community Services and the Michael and Maurizia Pacha Foundation that is funded by the Ryan White program. Thank you so much for this. This is incredible. We hope we continue to have these conversations, ongoing. Let us normalize this conversation. Let us destigmatize. Let us reach out to our community and know that there is support out there and there is help. Please, Alan, if you don't mind putting the HIV logo. I thank you so much, Dr. Sikipa. Have a good night. You've stayed up really late for us. We appreciate you. Tanya, thank you. And thank you a lot to Afrique Today online TV for making this possible and for hosting this program. And to all our viewers that have joined us today, thank you. Stay safe and please get tested. We care about your health. Have a good night, everyone.
Thank you.